Jimmy Carter, back in the news this week. Because this week, former President Jimmy Carter turned 100 years old after entering hospice care when he was 98 years old. At this point, he has now been in hospice care for 19 months. But wait, isn't hospice for people with a life expectancy of less than 6 months? Isn't there some sort of limit on how long you can be in hospice? Well, yes and no. So to be eligible for hospice care in the first place, a doctor needs to review your situation and certify that in their medical opinion, they believe that your life expectancy is 6 months or less if your illness runs its normal course. And then once you're in hospice care, every few months, a doctor needs to review your situation and recertify that in their medical opinion, they still believe that your life expectancy is 6 months or less, and they're going to need to justify that in some way. Meaning, can they point to some objective measure of your overall decline to justify their prediction? Like, are you losing weight? Are you spending more time in bed? That sort of thing. And so long as at each recertification period, your doctor can point to some objective measure of your decline, technically you can be in hospice indefinitely if that's your preference. Of course, it's always going to depend on the specific details of your situation.